Hello, I'm Irvine Mayor Christina Shea. Here with me today is Irvine Police Chief Mike Hamel, Orange County Fire Authority Chief Brian Fennessy, and from Hoag Hospital, Dr. Philip Robinson, who specializes in internal medicine and infectious diseases. And also with me, Irvine Vice Mayor Mike Carroll, who I have been working with around the clock. We are taking every step necessary to safeguard the health and well-being of our residents and our businesses. I want to thank you for how we have come together as a community to prevent the spread of COVID-19. As the third largest city in Orange County, we also must realize that we may have higher number of confirmed cases of COVID-19 than some smaller cities. I have been working with Supervisor Don Wagner to encourage the county provide city-by-city COVID-19 statistics. And as of today, Irvine has 33 confirmed cases. And as we have seen across the state, this number will continue to grow. Our thoughts and prayers go out to those fighting this disease, and we wish them a speedy recovery. Please remember that while even one case is significant to our community, the percentage of those who are ill is very small when compared to our overall population of more than 280,000 residents. City Hall and our many city facilities are closed to the public, although essential city services are being performed. Our parks remain open for passive use, but please exercise social distancing if you are there. We have made it easier for you to do business with the city virtually, and we've set up a virtual community services online site that offers recreational and educational resources. A full list of city resources, as well as county, state, and national updates, is available on our website. I know many of you are concerned about how this crisis will impact your personal finances as well as your financial health of your business. I too run my own business and understand how difficult it is when you feel your livelihood is at stake. The Irvine City Council on March 24th passed a resolution protecting our residents and business owners from evictions, rent increases, and service and utility disconnections during the period of the COVID-19 emergency. Additionally, another resolution was passed to recommend all retail centers provide protective supplies to their employees. Also, Governor Newsom announced that 4 major financial institutions will offer mortgage relief for those impacted by COVID-19. Additionally, the Small Business Administration has offered disaster assistance loans to help companies facing hardship. If you've lost your job during this difficult time, unemployment benefits are available to you. The Greater Irvine Chamber is also offering resources for businesses to navigate these challenging times. We are closely monitoring developments and working with partners to mitigate these serious impacts to our community. At this time, I would like to introduce Irvine Police Chief Mike Hamel to provide an update about the Irvine Police Department. Mike?
Thank you, Mayor. Hi, I'm Irvine Police Chief Mike Hamel. The rise of COVID-19 is concerning to all of us. The Irvine PD is here to protect the Irvine community from threats large and small. As we work in partnership with you, our residents, and other stakeholders to slow the spread of COVID-19, I want to assure you that we have taken proactive measures to safeguard your welfare while ensuring the health and safety of the men and women of the Irvine Police Department who serve this city every day. As Mayor Shea mentioned, it's within our power to mitigate the spread of this disease. This is true for our community and for members of the public safety. To that end, Irvine PD employees undergo a daily medical screening to ensure they are healthy and able to perform their duties. Our field personnel have been issued personal protective equipment, and they have received COVID-19 specific training on the use of that equipment for themselves and anyone they encounter who may be ill. Please be assured that we have adequate personnel to handle any situation and maintain order in the city. We have activated our Emergency Operations Center, and we are monitoring local, regional, and national developments. I want to thank you for remaining calm and showing respect to your neighbors and our personnel during this challenging time. Last, as you know, the governor has issued a stay-at-home order for everyone not performing essential services. You can leave your house to pick up food, groceries and medicine, visit your doctor, care for a relative, or go outside for some fresh air or exercise. Otherwise, for your safety, please respect this order. Social distancing is the best way we can slow the spread of the virus. Please help us keep our community and our police employees healthy by staying at home. Remember, this disease can affect anyone of any age. It does not discriminate. That's why these measures, while they may seem strict, are so important. And finally, while we have modified our police response to some calls, for your safety and for the safety of our police officers, Please know our response to priority calls threatening public safety will not be delayed. Thank you for joining me in the fight to keep Irvine healthy. I would now like to take this opportunity to introduce Dr. Philip Robinson from Hoag Hospital.
Thank you. I'm Dr. Philip Robinson. I'm the Medical Director of Infection Prevention at Hoag. Many patients have been asking me when they should see their doctor or go to the emergency room, and that's really based on the symptoms that you are experiencing. If you believe you have been exposed to the virus, even if you are not showing symptoms or have very mild symptoms, you should stay home and contact your healthcare provider. If you just have a runny nose, maybe a low-grade fever and some fatigue, you'll probably be fine just to stay home and take care of yourself and let the virus run its course. You can certainly call your healthcare professional and ask for advice, but there are certain symptoms where I would recommend that you make that call and possibly be seen by your healthcare provider. These would include increasing shortness of breath, a fever over 100.4 degrees Fahrenheit, headache, and certainly the inability to eat or drink. You can contact your healthcare provider or one of Hoag's urgent care locations, and you will be provided with instructions over the phone. I'd like to briefly address the issue of testing. We've all heard a lot about testing, and testing is changing, and those who get tested is also changed. We have moved from trying to contain COVID-19 to a mitigation strategy. This means that we are trying to minimize the consequences to our most vulnerable community members. As a result, only those who are most at risk for the serious complications of COVID-19 should be tested. This means that if you are without symptoms or just have mild symptoms such as that sore throat, a little bit of a cough, or a low-grade fever, you do not need to be tested. For this group of people, the test results will not change the recommendation to stay home and self-isolate. However, if you have symptoms, and those symptoms are progressive, and you become sick enough to be admitted to the hospital, a resident of a nursing home or other group home, or a healthcare worker caring for the elderly, you should be tested. I also want to stress the fact that data from Irvine and other cities is reflective of where the virus cases currently are. In other words, transmission didn't necessarily occur in Irvine or in that particular city. It could have occurred elsewhere because COVID-19 is currently present in all communities in Orange County. In fact, the actual counts from city to city could be, and most likely are, higher because testing is currently prioritized to those who are at greatest risk or who are the sickest. Asymptomatic individuals with mild disease may not be reflected in those counts, since many of them would not have been tested. And this just reinforces the importance of practicing social distancing. As directed by the governor and Orange County healthcare officer, regardless of the case count in your particular city. Social distancing truly helps reduce the spread of this virus. Besides keeping you and your loved ones safe, it eases the burden on our hospitals and healthcare systems, and it protects the most vulnerable residents in our county. When it comes to Hoag's preparedness for COVID-19, let me start by saying that we have been ready for this for months. In fact, we've really been ready for it for many years. Like many hospitals, we care for patients with infectious diseases frequently and are well prepared to provide them with the best appropriate care while ensuring the safety of our staff, patients, and visitors. We have a world-class infection prevention team leading our efforts, which include education, training, drills, so that our clinicians have the information, tools, and communication systems to properly screen and isolate patients for infectious conditions. Hoag has specialized wards at both campuses where we are cohorting patients who have or may have COVID-19, so that we can better protect our healthcare workers who are caring for them. Hoag is very grateful to serve a community that is so generous in rallying around the hospital. From free meals to supply donations, the community has lent a helping hand to support the hardworking men and women at Hoag as they tirelessly try to care for these patients in need. On behalf of the entire organization, we thank you. Now I'd like to introduce Orange County Fire Chief Fennessy to make some remarks.
Thank you, Doctor. The COVID-19 pandemic has forced us to change the way we live and the way we, as firefighters, serve you. What hasn't changed is our dedication, compassion, and mission that when you dial 911, we will be there to help. Nothing will stop us. In order to fulfill our mission, we have made some adjustments to reduce the risk of exposure to COVID-19 to you and our workforce. It starts when you call 911. Our dispatchers are asking additional questions to help prepare the emergency crew that is headed your way. Those questions include asking if the patient has a fever, a cough, or difficulty breathing. We're also now providing the patient's phone number to the engine company so that they can contact the patient and gather additional information for the safety of everyone involved. Additionally, we are asking patients if they are able to come outside and meet the engine crew. That limits exposure to other people in the house who may be symptomatic. Our paramedics now wear full personal protective equipment, which means goggles, gowns, gloves, and masks. And they also immediately place a mask on all patients. Whether they have a broken leg or respiratory issues, all get a mask to reduce exposure. To further protect our workforce, we have closed all OCFA facilities, including fire stations, to the public. We conduct health screenings for all employees as they arrive to work, which includes a series of questions and taking their temperature. Our firefighters in the fire stations go through health screenings twice a day themselves. And the 6-foot social distancing is now the norm for us. All of these measures in place are to safeguard against the spread of the coronavirus and ensure our firefighters are healthy so that they may continue to serve you. We all need to be all in. Thank you, Mayor Shea, for having me here with you today.
Thank you very much, and I want to thank Chief Hamel, Chief Fennessy, and Dr. Robinson. I know our community appreciates you. We are thankful that you took the time to address our residents. I would like our residents to remember we are all in this together, and we will successfully overcome this threat. If you have any questions, the city has set up a hotline for non-medical COVID-19 questions. Thank you, and stay well.